as some of us have been interested in the topic, oops, what happened here, of how frequent is, how common is cerebral palsy? And is the incidence increasing or decreasing for quite some time? There was a massive change in our massive demographic shift that occurred in the latter quarter of the 20th century, in that the survival of very small infants became so much more common than it had been before. So in 1960, we have reasonably good national data. We think there were about 150 one-year-olds who had weighed less than 1,000 grams at birth. By the 80s already, we were up to 15,000. And, you know, this is a population that barely existed, the baby who survived weighing less than 1,000 grams at birth. And we always knew that those children had a very high risk of cerebral palsy. Since the days of William John Little, we knew that their risk of cerebral palsy is quite high. It's about 10% under 1,000 grams. So we wrote in the early 80s that it seemed unlikely that we would not see an increase in cerebral palsy simply because of the greater survival of very premature infants. We gave some specific numbers, and we didn't think that we were saving lives. We weren't quite at the same pace saving brains. And cerebral palsy was the key marker of that we thought we would look at. And a dozen years later, we wrote again about this, and by now, more epidemiologic studies had emerged from several countries, not as many as we have now, but by the 90s already. And we got the impression that there had been at least a 20% increase in the rate of cerebral palsy because of the increased survival of very preterm infants. And we said an apparently unavoidable side effect of the increasing success of newborn intensive care is a moderate rise in the childhood prevalence of cerebral palsy. And when we say this, we should also say, but of course, also, a lot more kids without cerebral palsy are also surviving. So, the reason to know this is to be ready to provide services, to be ready for recognizing that there's a need out there. We've often said if we could spend as much on children, very tiny babies, after they've been born as we do when they're being born, we could do good things. So this is a fairly typical data from the latter part of the 20th century from Peter Farrow. As you see, in the babies under 1,500 grams, this is where the increase in the contribution of cerebral palsy in kids who had been born less than 1,500 grams at birth. And in fact, I just point out, one of the very first big birth cohort studies, British births, 1946, had not a single child with cerebral palsy who weighed less than 1,500 grams at birth because they had not a single survivor who had weighed less than 1,500 grams at birth in those days. So we have to keep aware of the demographic shifts that are occurring in our populations. Now we have better data, and I'm going to show you data from three sources: the Great Surveillance of Cerebral Palsy in Europe, SCPE, which amalgamates now. It's now grown to 23 registries in 20 countries. In some small countries like Malta, it's nationwide. Others, it's regions. The Australian CP register, my dear friend Fiona Stanley, we set that up in Western Australia, the first one, and they've been increasing that. Every state in Australia has a cerebral palsy registry. We're a little bit behind in the United States. All we have for monitoring time trends is the CDC's Autism and Developmental Disabilities Monitoring Network, which assesses 8-year-olds living in 4 regions, some in Alabama, some in Atlanta. That was where it started, Metropolitan St. Louis and Southeastern Wisconsin. And they've gone through cross-sectionally, keeping in mind Renee's concerns about that, and looked at the frequency of disorders over time. So in that publication just came out. In fact, I may not even be out, but I've seen copies of it. They looked in the combined Australian and European data for time trends. They applied time trends first from 1995 to 2010. And you'll see that now we're beginning to see a modest decline, mostly in the first few years of the 21st century, not much going on between 1995 and 2000. So this peak we saw before is beginning to reverse. And then they did a review of the world's literature, looking at single center studies, and they really thought that they had in the world of CP reporting, there had been at least a 25% decline, just simply since from 2013, already by 2021, the latest data, down from 2.1 per thousand to 1.6 per thousand. Now, this is rather unstable data. It's not from one single registry, but an amalgamation, a meta-analysis of the world's literature. So how are we doing? Well, as I said, the only database is that CDC's Autism and Developmental Disabilities Network. And in that system, we saw a 17% decline in CP prevalence from 2010 in 2010 was 2.9, which was already a decline from 2006, the first two waves, about a 17% decline. The decline was interesting. It was found in pretty much all groups of children except African-American children. And there was a suggestion that the decline was mostly in low birth weight infants. So we have somewhat soft data. I think the international data is better, but it does appear that we're having now finally a decline in CP prevalence, largely because of something, we don't know what, I'll talk about that in a moment, going on with tiny babies. Very important to note that the data is from high income nations. What little data we have from low income nations is that the rates are persistently a bit higher, with different contributors. They actually don't have so many preemies contributing. In the US right now, probably 40–50% of CP comes from the premature population. We saw a very nice paper from, very well done paper from Uganda, which showed that only 4% of their cerebral palsy was coming from tiny preemies. They get things like cerebral malaria, other things going on. And unfortunately, the rates remain somewhere in the 3 to 4 per thousand range. So briefly, I'll talk about what could explain this recent decline in small infants in high-income countries. Well, as you know, the traditional risk factors for premature birth are birth asphyxia, for cerebral palsy are birth asphyxia and premature birth. And outside, we have that paper, if you'd like to look at it, by William John Little, who first identified those two factors as absolutely key in the development of cerebral palsy. How about interventions in those particular areas? Prevention, head cooling in birth asphyxia. Many of you may have heard of this, but this development of a technique to cool babies or cool babies' heads for 3 days in the first 72 hours usually of life, by a couple of degrees, has been shown in a remarkable number of studies, one of the most consistent series of publications, that it reduces the risk of death and the risk of disability together. Basically, if you pull it together, about a quarter of reduction in the death rate and about a quarter reduction in the disability rate, most of which is cerebral palsy. So that is a useful, wonderful thing to know. And when you have an asphyxiated term baby, this is only for use in term babies. You can't use that cooling in preemies. It's not good for them. That's an important technique. And it's actually not that complicated a technology to keep kids cool. It can be used in third world countries as well. And magnesium sulfate in labor. There were a number of case control studies. Our own cohort study showed that if babies have been exposed to magnesium sulfate during labor, they seem to have lower rates of cerebral palsy. These are preemies under 32 weeks. Magnesium sulfate was used for other reasons, and it was noted in observational studies, Diana Shandell, Karen Nelson, our own study, that there was a lower risk of CP, controlling for all the factors, in kids who'd received magnesium. So then some randomized trials were done, and basically all the randomized trials are also fairly consistent, showing a decline in the risk of cerebral palsy in kids who had been exposed to magnesium sulfate in labor. And now in many parts of the world, under 32 weeks, if you're coming in labor, they will give, if the mother can tolerate it, a dose of magnesium sulfate. And even Coffee is good for you. I think I was mentioning that earlier. You don't want to get between people in that coffee. Caffeine is used in neonatal intensive care units for apnea of prematurity. And in fact, there's some evidence, it's not as strong, that in the a very large trial in Canada, that you have a lower rate of cerebral palsy in the kids who were given caffeine. And finally, one more thing that we've been very interested in is something called permissive hypocapnia. What that means is that if you have a tiny baby in the intensive care unit on a ventilator, you monitor two things, their oxygen and their carbon dioxide. Now, if you ventilate very, shall we say, aggressively or ferociously, that CO2 starts to go down very low. Now, we've known from animal studies and from elsewhere that a low CO2 can cause cerebral vasoconstriction. So a movement began to suggest that maybe that's not such a good idea. And there's some good observational work, including by us, but by others, showing that allowing that CO2 to go, don't get it down so low through aggressive ventilation, is associated with much better outcomes. I'll show you in a moment the slides. For example, in our data, in the lowest quintile PCO2 in ventilated babies had much higher risk of cerebral palsy. And this is just an observational work. The trials have not been there have been attempts to do randomized trials. So this is not easy to do. You can imagine how hard it is to do. And a couple of meta-analyses, and basically the few trials that have been done don't really show an effect. But I think many of us think that practice has evolved sometimes ahead of randomized trials, and people are being much less aggressive in ventilation and allowing the CO2 to be not trying to drive it down too low. And so that's another candidate for a reason why our behaviors should be changing the rates of cerebral palsy in low birth weight infants. So any of these could be possible. I think the birth asphyxia story is, of course, for term infants, but the last three things I mentioned are in preterm infants. But truth be told, we really don't know what is pushing the decline. Perhaps a combination of factors, especially affecting low birth weight infants. But the good news is the prevalence of cerebral palsy is declining modestly, at least in Western nations. Thank you.